My name is Moreno. I'm a first-year Masters of Athletic Training student at North Central College, and today I have here joining me David and Bryan. And I'll start with a little introduction about you guys. So David was a head and strength conditioning coach for the Air Force Special Operations Command at Pope Army Airfield, North Carolina. He was a mentor for strength and conditioning coaches as part of an internship program. David also has valuable experience throughout collegiate athletics, all the way from the West Coast of University of Washington to the Midwest region. Now currently as the head of performance at the University of Illinois at Chicago. And for Bryan, Bryan Yonka graduated from Miami, Ohio with a bachelor's degree in health education and athletic training, and then obtained his master's degree in education from Northern Illinois. Bryan also served 13 years at Loyola Chicago with the Ramblers and is now currently the head athletic trainer at the University of Illinois at Chicago. So I just want to thank you guys for joining me here today so we can discuss a little bit about strength and conditioning and athletic training and the interprofessional collaboration of these two in the collegiate setting. If you guys want to just say a few words, maybe like introduction of yourself. If I missed anything, feel free.
No, it was a great introduction. Obviously, I've been doing this for about 25 years in a couple different settings, but most recently working in intercollegiate athletics. I think the topic is an important one, obviously, like the interdisciplinary approach to what we do. I think Bryan can probably tell you for many, many years, it was very siloed in the approach to how we did our jobs. And there was only collaboration when it was absolutely needed. And now I talk to Bryan as much as I talk to my wife, in terms of like what's going on with our student athletes in regards to their return to play, any sort of mental health issues that are going on. And I think that collaboration with him allows me to do my job at a really, really high level, and it allows me to be very confident in what I'm doing as well.
Yeah, I think the holistic approach is something that was, it's really gained a lot of traction within our areas, and Dave is exactly correct. When I first started this, that you had the weight room was, that was what it was. It was just get in there, scream and yell and throw weights around. And then our area was, now we have to fix everything that's been broken, and no one really communicated. Or if it was, well, why are they doing this? Stop doing that because you're hurting them. Or, well, they need to be stronger so they don't, the talk was there, but it was never really, okay, how do we work together to make this better? And with over time and over kind of ego checking, I guess would be the best thing to say, is we've learned that we can coexist and we can work together. And if we take that approach, we actually get better results, and it makes for better true athletes than just trying to do it all by ourselves.
Yeah, no, I definitely think you guys made a great point, especially how everything may have seemed siloed back in the days, but we're making a great transition, and everything's just developing to where like the healthcare model is like becoming a little bit more integrated with all these healthcare professions. And we're identifying that when we all collaborate and, work towards a common goal, like the results show in our athletes and just performance on the field. Just for the sake of discussion, I do want to take the time to just like define the professional roles and responsibilities of what it is to be an athletic trainer and what it is to be a strength and conditioning coach for anyone that will take the time to listen in on this conversation. But as we know, an athletic trainer is a licensed healthcare professional that collaborates under the guidance of a physician, and they work to provide injury prevention, emergency care, clinical diagnosis, and therapeutic intervention and rehab. And as for a strength and conditioning coach, responsible for the development of all physical qualities, including speed, strength, power, agility, cardiovascular endurance, and it's all related to athletic performance and improvement. And even like just from those definitions alone, like we know that there can be a lot of overlap in terms of like the what it is to provide these services, whether it's an athletic trainer or a strength and conditioning coach. But I want to open it up for the first question. And as we said, an athletic trainer is responsible for kind of like that acute emergency care from the moment an athlete gets injured. And the athletic trainer, for say, that's their area of expertise and they're responsible in that moment. But at some point, there's like this transition of care now that we're seeing where the strength and conditioning coach can really take it from a certain point in the rehab and really progress that athlete to get back to feeling close to 100% to have a safe return to sport. So, Yonka, if you want to speak a little bit about your responsibilities in like that initial rehab phase for the athlete.
Yeah. So, in a situation where there's an acute injury, the first thing we typically will tend to do is look at what they are able to do, and see what is a safe, what is safe and what is allowable, and will not cause further injury or further damage. So, in the case of like an acute ankle sprain, well, we know that there's going to be an inflammatory process, so we need to try to maintain or control that as much as we can, knowing that the inflammatory process is part of the healing process. So we look at how do we protect the student athlete from doing further damage, but we also know that time off means deconditioning, which and it means that that athlete has is in a unique situation in which there might be a little bit of a setback when it comes to their future performance, both physically and mentally. So we look at that injury a lot differently now than we would have previously, and instead of looking at necessarily what they aren't able to do, is what can they do. So if it's in an acute situation, as long as it's safe and not going to cause further damage, we, instead of holding them out, we look at what they can do in maybe in the area of sports performance, and this is where David and I would communicate and kind of look at, okay, so they can't run, but they can bike, or they can they can do some type of other activity to, one, make them so part of the team, but also get something productive out of the workout so they're not completely deconditioned.
Yeah, no, 100%. Like assessing the athlete, knowing what they're capable of, and then once you feel like you've gotten them, maybe like from a baseline of like we've got past the acute inflammatory phase, now we really like get them back to like their basics, range of motion, and then a little bit of like developing that strength. And this is where we can make that smooth transition to the strength and conditioning, and kind of like David takes it from there, as you mentioned, and making sure that we're like having clear communication so that it's like a safe transition there.
Yeah, go ahead, Ryan.
I was going to say what we've instituted, and this, we really as a department in the past 2 years, is having these weekly check-ins as between the coaches and the support staff, and looking at, okay, here's how the week is going to lay out. Here's what's going on from a health standpoint, and here's what we're going to do in the area of performance, and how do we make sure that we maximize every student athlete and maximize that week to allow for the best performance. And we know that things are going to happen, and that in real time we're going to make those adjustments, but it's I would say a much different way of trying to really get our student athletes to be at their maximal, and putting in maximal effort, because we're trying to be as proactive and stay on top of these things before they happen, and if they do, we can make those changes.
Yeah, I was going to add to that, a key player in this interdisciplinary model is the sport coach, because they need to be a part of the conversation too, right? So in addition to Bryan and I talking, we're also talking to the sport coaches about like, what does training look like? You know, these are the things we're going to be doing in the weight room. How do we want to make sure it's complementing what you have planned for training today at practice, right? So obviously the sport is the primary objective, but at the same time, when we look at it as a flat organizational model where we're all contributors, we're all stakeholders, and the student athlete is the primary beneficiary, if we can have these intelligent talks and intelligent planning, then we can maximize productivity in the allotted time that we have with the student athletes.
Yeah, no, and I agree 100%. Like also like it's not just the athletic trainer and the strength and conditioning coach that are part of the plan, but also integrating like the sport coach and making sure they're also in the loop. And everything is just kind of like being communicated and everyone's on the same page for the common goal, especially when it comes to an athlete injury. And I know like even from the healthcare perspective, like there's a lot of pressure if there's an athlete that's injured, and there may be external pressure from like the coaches or athletic directors and trying to get this athlete back to sport as soon as possible. But we know like as part of our profession, our responsibility is to make sure that that athlete returns back to sport safely and appropriately, and it's not a premature return to sport, because a really interesting thing to discuss is athlete availability, making sure that we're not overtraining them, but we're also making sure that once they do return to sport, they're returning to sport 100% and we're retaining them there and minimizing the risk of re-injury, and then we're looking at another setback. So I think those were like great points right there. I would want to like kind of like move on a little bit to kind of like load management and like how this is discussed amongst the athletic trainer and the strength and conditioning coach. If David, you want to start off there?
Yeah, I would say that this is probably the more challenging aspect of what we do, more so than like a return to play for an injured athlete. Because when you have an injured athlete, you sort of have a timeline and expectations, and it's a little bit more predictable. But with load management, you're trying to balance like the training needs of the sport coach and mesh it with what you're trying to do from a training standpoint, from a development standpoint, and make it all like sing synergistically, right? Figuring out when you're going to have high levels of conditioning, when you're going to cut back in conditioning and let the conditioning really be sport related. It's sort of like an orchestra, right? Like everyone's playing their instruments and it's all got to work together, right? So what we do with that is we make sure that like I propose a calendar of what we're going to do for like, let's say the off season, right? For the first 8 weeks, we're going to really focus on maximal strength. We're going to do a linear progression during those 8 weeks. During that time, before we get to our 20-hour segment, we're going to incorporate a lot of conditioning on top of that. So like workloads are really, really high. But we can sort of get away with that because they're not playing as much soccer, right? Once we switch to that 20-hour segment, I cut back the conditioning workloads in terms of like max effort sprints, distance covered, because I know they're going to be getting that on the soccer field. And then I changed my focus in the weight room as well, right? Like we'll shift from like a max strength phase into what we've been doing now, which is like our power development phase, where we've put our 8 weeks in. We know what our new 1RMs are. Now from there, we're going to be training a percentage of that and focus on rate of force production. So it's a way to decrease workloads in the weight room and have it sort of complement what's going on the field, which is a lot of like full field soccer.
Yeah. No, and 100%. I think that example of soccer or like with the soccer team and what you do with them is great, and especially being able to apply that to like all the other sports that an athletic trainer and as a head sports performance coach, like you would be responsible. So being able to tie that into like sports specificity and then the injury that you're dealing with, and then kind of the programming piece for like these individuals and like the team as a whole. And another interesting thing is athletic trainers, they're also taught how to kind of like follow these periodization programmings, especially with the phases of rehabilitation from the moment of injury to the kind of like subacute phase and then advanced progression under rehabilitation. But one interesting thing that I found was that, and one of the studies that I kind of like went over, is athletic trainers are less likely to take courses that focus on the opposing profession, say strength and conditioning coach or strength and conditioning coaching, whereas strength and conditioning coaches are more likely to actually take courses that focus on athletic training and kind of like learning the common language in a sense. So I thought that was very interesting. But at the end of the day, like, we have the athletic trainer kind of like in that early phase, and then we're kind of like respecting that the strength and conditioning coach is taking it from there. And at the end of the day, it's a collaborative process for the athlete to like get them back to sport safely. So another thing that I would like to kind of talk about is when it comes to injury screening, we know like athletic trainers are responsible for like that pre-participation physical for athletes and kind of like collecting this data. But how is this data, if it is like kind of shared across with the strength and conditioning coach, to like really pay attention to athletes that may be more at risk of injury? If you want to kind of speak on this, Bryan.
Yeah, so I said there's a lot of different tests and a lot of different things that you can screen for. We typically do, the only thing we really screen is previous injury. Only mostly because we know that there's a direct link between previous injury and the potential for future injury. So you can look at you can do different tests and you can look at all the different assessments, and there's a lot of conflicting data that don't necessarily say there is a direct causal link between those screenings and predicting future injury. So right now, I would say that we don't really utilize any of them other than looking at anything that's the only screening that our physicians really look at is core balance. And that's more related to for knees, especially for lower body sports than upper body sports, because we're looking at knees, really knees, and looking at making sure that they have good, adequate enough strength to support them in their sport. Each sport is allowed or it can do additional assessments, and baseball is probably the one that does the most. Just I think because of the high volume of study that's out there, looking at different angles and trying to predict, volume of throws and things like that to mitigate some injury risk. I've gone through and I've done my own research and try to figure out what is there one good qualitative analysis, and I don't know if there is. I think what Coach Marmon and I do, and we do this with our coach as well, in regards to men's soccer, is we try to look at the trends of what injury we may have had that year, and say, okay, we had a high volume of hamstring strains. How can we incorporate something through this next cycle as we bring them back to try to mitigate that, and see if we can't fix that internally and follow that trend versus necessarily trying to predict what we're doing. We kind of are reactive in that sense, but in this past season, we went from a year before having multiple hamstring strains to one. So I think by utilizing that, we're I think addressing the issue without necessarily having to screen.
Yeah, no, that's great. David, if you want to add a little bit on that as well.
Yeah, obviously the medical health history is going to be your biggest indicator, and I talk to sport coaches all the time about that, like during the recruiting process, is pay attention to their injury history, because that's gonna tell us a lot. But yeah, to Bryan's point, screening is cool. It gives you a lot of good data, things to look at. The biggest thing for me is it helps guide my programming. So if I see deficiencies in certain areas, like with baseball, we do a lot of screening, then I'll just incorporate things sort of in a microdose fashion into our programmatics to address whatever deficiency we see, whether it's eccentric hamstring strength, whether it's internal shoulder rotation, what have you. I'll just sprinkle that in on a daily basis as a way to sort of address that without abandoning like the big picture, if you will. So yeah, I really enjoy those sort of debriefs at the end of the season where we look at like our injury trends. If we do end of the year screening, I'll take that data and listen to what the medical professionals have to say, and then I'll just make adjustments and to my programming accordingly. But you also have to keep in mind, like now with trends in college athletics, where like your personnel changes drastically from season to season, that that changes a lot in terms of like your programmatics as well. I mean, perfect example would be baseball. The past few years we've had a very senior veteran group, and so my programming was a little bit more aggressive in season. This year we have a very young group, so I'm taking a much different, more conservative approach to load management and volume in season than I have in the past, just because I have younger kids that just aren't used to dealing with those sort of stressors in season. So again, you just recognizing who you're dealing with, what sort of training maturity they have, and then look at the trends.
No, I think that's a great point, especially like paying attention to like the group of people that you're working with and being able to kind of like assess their capabilities and how much we can really challenge them within a tolerable limit before we kind of like refer back to that. What we mentioned earlier is like not overtraining them and being able to manage them and progress them adequately to like minimize that risk of injury. I want to take it to another topic of discussion, and this was through one study that I found over at University of California in Berkeley, where they had a new athletic director come in, and this was back in 2015. But a new athletic director came in with the idea and like the philosophy that athletic trainers and strength and conditioning coaches are really like a keystone piece to like the success of programs and like athlete development and athletes success. And she kind of like established this five components for her like kind of philosophy, and it was skills, fitness, mental toughness, lifestyle management, and culture. And when I kind of like dove a little bit deeper into culture, and I just thought like you can have a lot of athlete success, but if you have a poor culture, like you really won't see much success in the program as a whole. But I kind of want to bring this into like strength and conditioning and athletic trainers, and kind of like how you guys play an important part of developing that culture for like the athletic success. So if anyone wants to like kind of take a little stab at this question.
Yeah, I mean, I think the whole concept of culture has really kind of come around pretty importantly and pretty significantly through it, not just within teams, but also within the inner workings of the different areas of the athletic department. That's it's a really important topic that we brought into the athletic medicine is not just looking, because we've had a lot of turnover and since the pandemic, that we are trying to figure out a way to really maintain a consistent workforce. And so one of the things that we as a group have really tried to champion is that we're going to create a better culture within our area, within our staff, and try to find a way to maintain that staff for more than 1 year. We haven't had a consistent staff in the last 5 years, and we're all we've been doing a lot more interpersonal team building and trying to collaborate more with each other. so that we can make it through a year together. So I think within our own group, we've done a pretty good job of doing that and trying to create kind of a family feel and a culture where that for others to see that we are all kind of the teamwork is our mantra, and that we're all here to both help each other out, but also to help the student athletes.
Yeah, just to piggyback off that, I think culture is probably one of the most vital things you mentioned there on that list. And I think some people use it as a buzzword. But I think if you have a good understanding of what culture means, it's like having a clear understanding of like what your mission is and like what's the most important thing to you, right? There's a really good book called Good to Great by Dr. Jim Collins. And in it, he talks about the high performance model. And basically, he defines the high performance model is focusing on the most important thing and doing it exceptionally better than your peers, right? So I think for our staff, that's what we really focus on. It's like we want to provide, a first-class experience for the student athletes when they come in and work with us. We want to really embrace the role of being catalysts and taking athletes to places that they wouldn't be capable of going themselves. And I think taking pride in your work, right? Like every day you go into work every day and you have a choice. You can just show up and punch a clock, or you can show up and try to create excellence. And I know for our staff, like that's something that's really, really important to us, is doing our job at a really high level. And it doesn't mean that we don't make mistakes, and it certainly doesn't mean we're perfect, but like, man, we make those mistakes going 100 miles an hour with the absolute best intent.
Yeah, no, I think that was, a great way to kind of like sum up like this discussion, but at the same time, and even going back to Yonka's point, is like being able to like develop like a team where you guys can really like rely on each other, but also even looking at it from like a systemic perspective, is making sure that the turnover rate isn't there or is minimized, and also making sure that we're taking care of like our own professionals that are then in return going to take care of our student athletes. So making sure that's also not overlooked. And I know like athletic training and strength and conditioning, just because we're on this discussion focusing on these two professions, but we give a lot of like our time and sacrifice to like help others and develop these athletes and to like achieve success. And it takes a lot of sacrifice at times, but like kind of like what you said, David, is like making sure that we're doing it with the intention and that we're taking pride in our work, because at the end of the day, like, we do it because we enjoy it, but we also do it because we enjoy seeing others succeed, and kind of like reap the benefit of our labor here. So I think that was a great topic right there to discuss. Um, just in general, kind of like this uh, conversation that we've been having, I think like really kind of like highlights the essence of athletic training and strength and conditioning, and just like the benefits of when these two professions really have that good integrative uh, collaboration, and it really gets things going, and we start to like see the resonate in like the athlete success. I mean, do you guys have any or I want to end this discussion with, you guys have any words of advice for athletic trainers or even strength and conditioning professionals that are aspiring to get into this like line of work in the sports medicine, and especially in the collegiate setting? Any words of advice in that perspective?
Yeah, I mean, I think one is you really do have to be open-minded, that you have to be willing to put yourself out there and experience as much as you can. Um, the field is vastly different than when I started, um, in which we got that experience by being kind of just pushed into it and not having necessarily an academic background first. And so I think the pendulum has swung the other way, and the academic, which I in some ways is way farther advanced than when I was there, or when I was in those shoes. But I had the experiences that these young clinicians never had. So I think get the knowledge base, but be really willing to be humble and take a position that might not pay very well, but you're going to get the experiences and then move yourself up. I think it's very easy to leave school and say, well, I've earned this and now I want this. And I think it's if you're willing to put that time and energy in and talk to different people and kind of be in kind of be open, um, you'll get way more out of this, and you'll figure out really where you want to settle yourself, and you'll have a better appreciation for really what you're doing.
Yeah. So to echo Brian's point, obviously you need the educational foundations. You need to read as much as you can. You need to have a good, strong understanding of like programmatics, periodization. And then once you have immersed yourself with like a lot of good um, theoretical information, you need to go get hands-on experience because that's where the rubber meets the road, right? You need to be in situations where you're having to coach, you're having to correct, you're seeing things that aren't in a textbook. And you have an older, more experienced mentor there that can kind of talk you through those scenarios. Work on your soft skills, your ability to communicate with people. Because my job requires me to communicate with 18 to 22-year-olds the majority of my day, right? So I've got to be able to like shift that gear. And when I do this, I don't mean they're lower, I just mean they're younger than me. But be able to communicate and be relatable to an 18 to 22-year-old. But then I also have to be able to speak intelligently with physicians, sport coaches, administrators. I have to be able to talk to academic personnel. So like it requires you to have like a really good set of social skills where you can communicate effectively with all those people and present information in a way that's like absorbable for them. So yeah, theoretical, hands-on experience, and then work on your soft skills. I think another one would be you need to have, I think to really enjoy this line of work, you need to have like a commitment to like servant leadership, right? Like you have to love serving other people because if you're doing it for you, you're doing it for your reputation, you're doing it for, notoriety, then it's going to be short lived and you're not really going to be great at it, So I feel like the joy and satisfaction I get out of my work is like really in the one-on-one interactions I have with student athletes. It's not me posting something on social media where everyone can see and be like, oh my God, he's so smart and innovative. I mean, there's so many people out there that are doing that right now. And like, when you watch them actually coach athletes, it's pretty underwhelming. So I think the interaction you have with the student athletes is far more important than whatever system you've developed that you can present to people and charge money for them to listen to.
Yeah, no, I believe those are like some great points of advice that both you, David, and Bryan provided. I do want to take the time to just end this last conversation with any questions that you guys may have for me, since you guys were so gracious to take the time to join me in this discussion.
What's next for you? Where do you see yourself going from here?
I mean, I'm already eyeing an internship for my last semester in the program where I get to do an immersive opportunity. And I was talking to Bryan earlier before you joined in on the conversation. Now with the Chicago Fire opening up their new facilities in the city, they're offering a immersive experience for athletic training students. I think that's the next goal for me in terms of what I want to pursue in the meantime. But as soon as I'm done and graduating from this program, I'm very open-minded in terms of what's next. But kind of like how you guys reiterate is continuing to develop my soft skills and obviously gaining the education in the classroom, but now actually applying that clinically and in real life experiences and being in the environment, really getting a feel for what it takes to be in the profession and this line of work. So I'm definitely feeling like I'm growing every day and I'm developing into a better person in general as well. So there's definitely things that I've learned during my time right now in the program that you start to think back like, oof, maybe a couple years ago or when I was there, like I wish I knew this, and I could have like done better for myself. But I'm content with the progress, and just gotta keep pushing.
Well, we're both super proud of you, buddy.
Yeah,
Thank you. I appreciate.
keep pushing yourself. It's there are no limits in regards to learning. Just keep ask the questions and keep just getting as much exposure to things that you are interested in, and it'll take you far.
Yeah. No, I appreciate it, and I mean definitely, I definitely gotta swing by again and even get together and like have a discussion and just sit down, maybe even visit one of the local shops that were so famous, hash browns or something. But definitely take some time to swing by. Only 2 weeks of school left before, I'm on like a 3-week break.
Yeah, you have to check out the weight room, man. We've made a lot of really good upgrades.
No, I stay up to date, with the Instagram posts and everything. So I can't believe it when I see just how much change is going on. But it's great, all about the athlete experience, huh?
Absolutely, man.
Yeah. I appreciate it. Again, thank you for taking the time.
Thank you. I appreciate you.
Yeah.